Disaggregated Data in Nigeria by the Count Disability Nigeria Coalition, holding today, 4th of August 2021 at Dennis Hotel, Wuse 2, Abuja. Going by the World Bank and WHO disability prevalence rate of 15%, in 2018 it was estimated that about 29 million out of the 195 million population of Nigeria are persons with disabilities. However, the absence of concrete data to provide real usable evidence for this estimation reduces it to a mere abstract proclamation, and this has contributed immensely to the worsening exclusion and vulnerability of persons with disabilities in Nigeria. July 2021 marks the third anniversary of the commitments made by the Nigerian government at the Global Disability Summit held in the UK in July 2018 to collect and use reliable and comparable data on disability, to set up a data and research fund, and to use the Washington Group of Questions for both the National Census and the National Demographic Survey by 2023. The key objective of the 2018 Global Disability Summit was to deliver ambitious new global and national level commitments on disability inclusion. National governments and other organizations made 170 sets of commitments around the four central themes of the summit, which include ensuring dignity and respect for all, inclusive education, economic empowerment, and harnessing technology and innovation, as well as the two cross-cutting themes of women and girls with disabilities and conflict and humanitarian context and data disaggregation. At the summit, 10 national governments, including Nigeria, committed to using the Washington Group set of questions on disability status in upcoming national censuses or surveys, of which 7 countries, Nigeria, Kenya, Kyrgyz Republic, Malawi, Rwanda, Tanzania, Zambia, will include the questions in their national population census in the next 5 years. Despite Nigeria's GDS commitments to collect this disability disaggregated population data and the adoption of the Washington Group question set, a progress assessment carried out by the Count Disability Coalition shows that the absence of institutional frameworks and strategic guidelines on development of national disability database constitute some of the key reasons why most of the MDAs responsible for managing population and other demographic data are yet to fully commit to implementing the GDS Charter of Change. In fact, none of the MDAs have made any efforts to implement the commitment to establish a fund to support development of a national disability database. Prior to the 2018 GDS, Nigeria had committed to the implementation of the UNCRPD, which is the United Nations Convention on the Rights of Persons with Disabilities, by ratifying it and signing its optional protocol in 2010. As a UN member state, Nigeria also committed to the implementation of and meeting the targets of the SDGs by 2030. Both the UNCRPD and the SDGs make clear provisions for state parties to ensure collection and management of disability disaggregated data and use same to advance the rights and inclusion of persons with disabilities through the implementation of both documents. Article 31 of the UNCRPD provides that it is the obligation of Nigeria as a UN state party to undertake the collection of appropriate disability disaggregated data that will serve as reliable evidence and guide for governments in formulating and implementing relevant legal and policy frameworks, programs, services, and products in line with other provisions in the Convention. Similarly, Goal 17.18 of the SDGs requires Nigeria to strengthen her capacity. Goal 17.18 of the SDGs requires Nigeria to strengthen her capacity to provide high quality, timely and reliable data disaggregated by disability and other characteristics relevant in national context. It is thus expected that the country will ensure that there is proper disability disaggregation of all data generated for the purpose of designing, planning, implementing, monitoring, and evaluating policies, programs, and services aimed at achieving targets of each of the 17 goals and to ensure that no one is left behind. While the various national and international disability frameworks impose a legal obligation on Nigeria to ensure the collection and management of disability disaggregated database, the dearth of human and institutional capacity within and among relevant data collecting and management agencies of government at all levels, the poor understanding and use of globally accepted instruments and methodology for disability disaggregation of demographic data, poor synergy among governmental and non-governmental bodies on the collection, management, and sharing of such data, and the low capacity of organizations of persons with disabilities to engage with government and other critical stakeholders on a disability database pose great challenges to the implementation of provisions of all local and international disability frameworks with regards to collection and management of disability disaggregated data in Nigeria. The Count Disability Nigeria Coalition has recently developed a white paper on disability data in Nigeria in collaboration with other organizations of persons with disabilities, mainstream civil society organizations, and ministries, departments, and agencies as a strategic intervention to initiate the development of national policy and institutional frameworks for the collection and management of a disability database, to strengthen capacity of relevant agencies to deliver on the country's 2018 GDS commitments, and to influence necessary interagency collaboration on collection and management of credible, reliable, and nationally comparable disability disaggregated data in Nigeria. The white paper also forms the foundational basis for policy and institutional frameworks for the collection and management of disability disaggregated data in Nigeria, and is in line with the provisions of the Discrimination Against Persons with Disabilities Prohibition Act 2018, the UNCRPD, and the SDG. The white paper strongly recommends that relevant government agencies facilitate the development of nationally accepted and standardized instruments which properly integrate the Washington Group question sets as a first step towards achieving disability disaggregated population data. 2. The capacity of relevant MDAs whose primary mandate is to collect and manage population data should be strengthened in a strategic and sustained manner. 3. The Nigerian government and its relevant population data management agencies should key into existing international and multilateral groups and platforms such as the UN Disability Statistics Program of the UN Statistics Division, the Washington Group, and etc., in order to access available global resources, both financial and technical, that can help support development and management of disability disaggregated data. 4. Organizations of persons with disabilities should be supported to strengthen their advocacy skills to push for government implementation of the GDS commitments, build capacity on the use of the Washington Group question sets, as well as on capacity to track and monitor compliance by government, development organizations, the private sector, and other stakeholders in the area of disability disaggregation of data. Organizations of persons with disabilities should also be sensitized to key into global technical platforms on disability data, such as the Disability Data Advocacy Working Group, organized by the International Disability Alliance. This and other similar platforms can help strengthen knowledge sharing and learning among DPOs across countries. Disability disaggregated data or statistics can play a pivotal role across all aspects of development at national and subnational levels. design, planning, implementation, monitoring, impact assessment, and evaluation of legal and policy frameworks, as well as the allocation and prudent use of funds and other resources for the delivery of programs, projects, and interventions must be guided by accurate data, which considers all categories or sections of the population, including those with disabilities. We are using this opportunity to call on the federal government to fulfill its commitments at the 2018 Global Disability Summit, especially in the area of collection and management of disability data in Nigeria. The CAM Disability Nigeria project is funded by the Disability Rights Fund and implemented by the CAM Disability Nigeria Coalition, consisting of Disability Rights Advocacy Center, Joint National Association of Persons with Disabilities, Anambra Chapter, Disability Not a Barrier Initiative, and Mimijin Foundation for Women and Children with Disabilities. Thank you very much.
Provides some means of funds towards disaggregated data on disability issues. Apart from Nigeria, apart from the failure of MDAs in Nigeria, how about the international partners? And three, to just cap it all, how much have you been able to realize between that 2018 and now? Because last year when I had an interaction with engineer Augustine Wamugbedu, you know him very well, the president of Nigerian Disability Persons, he told us, or he told me, that the requirement that what was needed at that time was about 20 billion naira. So I don't know what the status is now. Needed as not towards disaggregation of data, but what was needed as a kind of COVID-19 response fund. That was what he told, that was what he said. So please, I just wanted to give us an update. If any money has come from the international bodies, international partners, since Nigeria has not been forthcoming on this, and how much do you have presently speaking? Thank you.
Okay, I don't like to mix issues. I don't think we should be mixing issues. The person that gave you that information knows the source of his own information. I don't have any information on the COVID-19 funds and all of that. What we're talking about is the lack of disability disaggregated data. And what the fund we're referring to here is in 2018, the Nigerian government, a whole team of people, government agencies, government representatives went to the UK and there was a global disability summit. And there, all various governments from different countries made commitments around various issues to do with disability inclusion. The Nigerian government, the representatives at that meeting, made commitments for Nigeria, on behalf of Nigeria, regarding various issues. They made commitments on inclusive education, they made commitments on healthcare, they made commitments on having a legal framework, they made commitments on a lot of things. One of the things they made commitments on is on ensuring that disability is counted in Nigeria. And the ways they were going to use to carry out those commitments is by ensuring that the Washington group of questions is used during census, by setting up a disability database, by setting up even a disability data fund that would also help to support some of the necessary things that need to be done towards achieving disability disaggregated data. Currently, we carried out an assessment, and currently none of those things are in place yet. And so we're working, that's why we have the representative of the Commission here. We want to believe that there was no clear-cut structure through which government could put some of these things in place. And so we're working closely with the Commission since it has been established to push for those things to happen. We're having this press conference to show you or introduce you to the white paper. Like I said, the white paper is basically everything I've read out here is an advocacy tool that serves to push government to meet up with those commitments that they made at the Global Disability Summit. The funds we're asking for them to establish is not funds for COVID-19 or anything. It's towards ensuring that disability is counted across board during census, during collection of any kind of relevant data that is being collected in Nigeria. I don't know if any other person wants to throw more light on that.